Welcome back to Two Nigerian Women. My name is Ibukun.
Hi everyone, my name is Abidemi and welcome to today's episode. We're happy to have you in studio with us. Hopefully it'll be a wonderful time spent with each other. But yes, I hope your week has been good. Your month so far and
Mm,
everything is going well with you. I can't believe it. We're in the fifth month already. At the end of the fifth month, actually. And in
hmm
2 days' time and a day's time, we're going to be in June. How time flies. I
Yes, at
still
the
remember
time
what
we're recording this is pretty
I know.
much the end of May, and by the time you get it, it'll be the beginning of June.
June,
So
yes.
yes, it's gone.
Really fast.
Yeah,
I think that's a
yeah.
lesson in itself for everyone. Anything you want to do, just do it. Because
Mm,
we tend to look at things as a whole block and say, oh, we want to start a project going to take really long. It's not that long. Because once you start it, the end is in sight, no matter how long it takes. So just do it. I think I'm talking to myself too, because I need a little bit of pepping.
ah,
There's so many things that I have in store. So yes, I encourage everyone to push yourself, start anything. The time to start whatever you need to start is now.
now, yeah.
Tomorrow, not next week, not in 2 hours' time. Now is the time. And with that, I rest my TED talk. Now, for our conversation today, tell me, what do we have? What do you have in store for
Uh,
us?
so I'm going to tell two true life stories, and we're going to talk about health advocacy. And once I tell the story, you would understand why. So, in our wider network, we actually were supposed to have a guest today, and she called me in a panic um, because one of her friends had literally just lost her first son. And what she was saying was, um, the boy was complaining of breathlessness and that he just couldn't breathe. He just couldn't breathe. And before her friend knew it, he had collapsed unconscious and now being pronounced dead. Literally about an hour before we were supposed to record the interview with her. And oh, it shook me because myself and Sissy were both mothers and we have boys and a girl between the two of us. And it was devastating news to hear of someone going through it. I cannot even begin to imagine the suddenness and the trauma, if you will, of the suddenness of that child dying. The death of a child at any age is traumatic. But what then this reminded me of was a conversation I was just having this weekend gone with another friend of mine whose son has just had keyhole surgery. The name is very long. I'm not a medical professional. I can't even pronounce the name. But what it feels like in the physicality is almost like the heart is beaten out of the chest. And the explanation the doctors gave her was he was born that way with several with more than two pathways for the blood. There's something about atrium and ventricles. The medical professionals will be able to advise on what it is in the comments. Please do. But like I said, I'm not trying to be a medical doctor. I just want to describe um, what happened with my other friend. So her son played football regularly. He's very active, was always doing something physically. And on the football field, he would literally just freeze, just stop, and not be able to breathe. They would, of course, take him off. They thought it was stamina. There's some people were saying, oh, he probably just needs to do more in
Mm,
terms of exercise to build the stamina. But she intuitively knew there was something wrong.
right, yeah.
Because, yeah, he would freeze, he couldn't breathe, and it would take time for him to recover. And then he would go again. So, in that sense, she took him to the doctor. The doctor said, oh, it's just, the age. It's just the age. They had examined him, listened to his heart, as far as they could tell in the moment, because obviously they were not on the football field with the mom and the son. In the moment, there's nothing wrong with him. They couldn't find anything wrong with him. So go away. If it happens again, bring him back. Things like that scare me because it had happened more than once before she went to the doctor,
Yeah.
told the doctor it had happened more than once, and the doctor was saying if it happens again, bring him back. Anyway, so they carried on with life as normal, so to speak. It happened again. She took him back to the doctor, and the doctor said, "Well, the only thing we can do is to fit him with a monitor, almost like something he would go around with in the event that that episode reoccurs,
Yeah.
to allow them to see what was going on with his heart." And the doctor even made the comment that, oh, it could take up to 2 years for anything to register, only because in
It's a
their
long
mind.
process. They have to, because also I think these machines, what it does, whatever that has been fitted, it
Mhm,
measures the heartbeat
mhm,
per, and then how much blood the blood flow is, and then they
mhm.
can use that over time as an average. So it has to be something that has to keep recurring. Yeah.
Well, yes, they wanted to see it reoccur. So occur and then reoccur to then conclude that this
Yes.
is what is going on.
Yeah.
So let us say, because she didn't give exact, timelines, but let us say it was fitted middle of the week, like working week. And
Mm,
Saturday is when boys normally go to practice football and so on and so forth. So on the Saturday after it was fitted, he went to football. The
yeah.
episode happened again. She immediately downloaded the data, sent it to the doctor's office for assessment, called first thing Monday morning. Oh, the doctor is not around. Have you sent in the data? Yes, I've sent in the data, she said to them. Oh, well, then you have to wait for the doctor to come back, and then they would assess what the data is.
Yeah. Yeah.
She kept calling every day, kept calling every day. Can't someone else look at this? This boy keeps, like, it keeps happening, and it is when it's in high intensity. I do not know if he should go back to playing football and so on and so forth, because we do not know what the problem is. She then called on one of the many days, because this took over a week before it was even the results were even assessed.
Yeah.
She then called one of the days for them to say, oh, they didn't receive the result. I'm like, are you people joking? What do you mean you did not receive the result? You told me you've received it. You were waiting for a doctor. She kept calling. So there was one day she was in meetings, working mom, in meetings, came out of the meeting. She said she had like 20 missed calls from the doctor's office saying, bring in your child immediately. That's when they diagnosed him with this condition. And genuinely, I cannot pronounce the name, but it's pretty much like when the heart is vibrating. So
Yeah.
it gives the feeling of your heart almost beating out of your
Busting,
chest.
yeah. Yeah. Busting out of
Yeah,
your chest. Yeah.
exactly. The boys, the vessels. So the way it was explained, you should have two major vessels that are pumping blood up and down. So the heart's supposed to contract and
Yeah.
expand, contract and expand. But his heart was just literally doing this because he had more than two of those pathways going through his heart. So his heart was vibrating as opposed to contracting and expanding. And he immediately had to have keyhole surgery to burn off the excess pathways to regulate the blood flow. This whole process took months to happen. And when the person that was supposed to come on for interview today told me about her friend who has just lost a son, who was
Mhm.
complaining of breathlessness, I was like, Lord, I hope it wasn't something similar to what happened to my friend. Because you don't know what you don't know. That's why they call it underlying health issues.
Issues.
You genuinely don't know what is happening in your body unless your body tells you it's going through a process. And
Mm.
then when you do know, especially for a child that can't advocate for themselves, you as the mother now approach the doctor, and the doctor is behaving like, I'm sorry, you're making a fuss about nothing.
Nothing.
Such a scary
Dismissing.
thing.
I think for me is the dismissal of one's concerns. Now, I had a health issue
Hmm,
which almost 13, actually almost 14 years ago, or maybe
hmm,
13, almost 13 years ago. I was having twins, and they were very, very dismissive of how I felt. And even
hmm,
when I was told that I had lost one of them, there was no, for me, there has to be some kind of empathy. I think there was a lot of
hmm,
matter of fact. It's done, it's done. How many people am I going to? But I just feel that you're human, you're not a robot. Yeah, you've been doing this job forever, but every patient is different. Just like every case is different, even if it's similar to the last case that you saw. And I just feel the health system, thank God for where we are, at least it's still to a certain extent a lot better than where we're coming from, but it still needs an overhaul. We have less doctors for more patients.
hmm, hmm.
We have a lot of our doctors that have relocated to Canada,
Yeah, that brain drain is
especially
terrible.
the
Yeah.
African diaspora, because in Canada, I think here you have
Hmm,
to retire after a certain number of years, but in Canada, your practice is yours. Nobody can take it off you. So
hmm,
it's not lucrative. So you still have a business in quotes, even though you're supposed to have retired, and you can work. Actually, you're not even, if you don't want to retire, you can continue. So
hmm,
it's favorable when it comes to them. So I see why there is that medical flight. People are leaving and going to Canada where the grass is greener for them. Yes, they
hmm,
have to write exams and do all of that, but it's a lot better.
hmm.
So I just feel like healthcare system is dismissive, and I I don't even think a lot of people are in it for the
Right
passion.
reasons.
I think it's just very robotic. Being there, done that,
Hmm,
got shared, and move on to the next thing. I think is a lot of extent is also the financial gains that come with it. Like I have a lot of I have a lot of friends that I know that have left the medical profession and are now doing plastic surgery in the UK. So injectables, vitamins, facelifts, all of that, chiseled nose, doing all of that, which is paying them. I have a very good friend that has a clinic on Harley Street
hmm,
because of how much, and she used to be in where she used to be maybe in Cambridge or something, and she moved to Harley
hmm,
Street. And that's what is happening. So a lot of people, that love, you came in because of the people, you are not anymore. It's driven by the profits. So a lot
hmm,
of them are not even like, let me give you an example. Last a while back, a family member of mine had to go in because we're registered privately, and then we were trying. They said she should do some tests on the NHS
hmm,
because they didn't have facilities. That's fine, and we had sorted it out, but it was taking too long for the NHS to get back to us. So we said, okay, we will go private. Do you know they
hmm,
had the audacity to tell us that
hmm.
even if we go private, we're going to meet them still. So it's better for us to stay where we are.
Really?
And she passed.
No.
She passed. When you look at it, I don't, because we're ready to move heaven and high water for her
Wait,
to go
hold
to
on.
facility.
Hold on. They refused to do the tests privately?
As far as they're concerned, it was a lost cause because she brought it on by smoking, and so it was
Oh,
a problem. And they
oh.
refused to, as far as they're concerned, they're waiting for her to die. There was no maybe, just maybe. In fact, according to fillers, once you get to that ward on the NHS, from that ward, you're going into a box. You're not coming out.
Wow.
But you never know until you're in that point, at that point. So
Wow.
if the things that they will have done to stall that process, they were
They
not
didn't.
really interested.
They were not
It was a waste
interested.
of money. It was a waste of energy. It was a waste of staff. There was no need to do that.
So just so for people listening, this is still in the UK. This is
Yes.
in the UK.
Yes.
And it's actually a significant issue now. So yes, we have the NHS, but the NHS has some unpublicized guidelines of
Yeah.
what they will do and
Yeah.
not do.
Not
So
do.
what, yeah. So what
Like
you're doing is
your friend and her and her mother that they kept moving, pushing around. That was a well-known doctor, and they kept
That
pushing
is
around.
another. Let me. That you
And
see, that's even
somebody had
another
given
story.
her life to the NHS,
Oh, look, that's
had been
another
in the
story.
system since she was maybe 20, 21, and they could not even
Hmm.
drop everything and do what they felt was best for this their doctor that had given their all. In fact, this doctor had lost family, relationship, marriage had broken down, family, like he was in the system, but he had nothing. When it came to push came to shove, they refused to intervene. So when you look at it, that actually, do you blame the doctors? There's no love. I'm only as good as what you can get from me. When you can't get anything from me, I am a statistic. I am a statistic. It's more convenient for you than for me being there, done that, got the t-shirt out, and then get the next person in. And it's something that we keep hearing and seeing and experiencing, because I've had my own experience. You've had stuff.
You've had my experience. Everyone has an NHS story, actually, when we think about it. So please, for those of us that are not in the UK and envy our process, it is not perfect. It's not perfect, and we're grateful for it, but we actually acknowledge it's not perfect. And
Mm,
and unfortunately, in a health situation, an imperfect process results in death. Let
mm,
us be frank. It's like saying, "Oh, the plane is not perfect, but I'll fly it anyway." That is, you have written a ticket to death.
yeah,
This is what we're trying to say, and which is why health advocacy is quite important. Everyone has one of these stories right now, and it's not because of our age, because this is happening to old and young
yeah.
alike, and in the middle.
Everyone
Old,
is
young,
affected. Everyone is affected.
everyone.
We've had the issue of the, like we've had online, the issue of the parents that they as far as they're concerned, they wanted to have clinical trials, and the NHS did not allow them to take their daughter. That it was a futile effort. Let
Hmm.
it be a futile effort for the parents. Now, do you love their child more than they love their child?
No,
Willing
the
to spend
justification
money,
was, we let's give it to somebody else that we feel has a better
but they're
chance.
willing to spend money to take their child abroad to try out a process. If it works, fine. It doesn't work, but at least they were going to. And the NHS took them to court and had an injunction stopping them because they are only suffering the child.
Hmm.
You can't love an individual's child more than they love their child. Why do you want to do that? So it's almost like I said, it's a statistic. Why don't I really wish that they would take themselves out of that place that you're just a patient, you're just a number, and see that person as an individual that has a family, has a father, mother, siblings, children sometimes, and allow this family do what they feel is best. What if you're not so confident, let them sign something and say absolving you from whatever. Sorry, I'm having a brain fog. What
It's
is
all right.
sign what they call the, if you're signing something to make someone,
Oh,
absolving them of whatever blame.
oh gosh. I have it as well. I've lost it now. I know what you're talking about, but keep talking to say
Yes.
I'll
So
get it
why don't
whilst
you make the
talking.
family sign that, so at least if anything happens, you are absolved from all of that. It has
Hmm.
nothing to do with you. If you can allow someone without asking anybody to want to do an abortion, I know a lot of people say it's not the same thing, but you're allowing the person that choice. You're not discouraging that person. So why are you discouraging people from wanting to try out something for their child? Now, I don't know if it's become legal, but I think there used to be an issue when people wanted to travel to all those clinics to help them assisted suicide. But there have been a few cases of people that have done it.
Hmm. Is it a disclaimer?
Yeah, maybe like a disclaimer, sort of, yeah.
Yeah.
But you have
Yeah.
people that have gone to Sweden, damn the consequences, signed a disclaimer that their wives will be, or their partners, significant others, will be absolved from whatever issue that's going to
Hmm.
arise from them taking this decision.
Hmm.
But you don't even have any issue with it. Do you understand? Because for me, what's like the government getting involved? Is it a morality issue? You're not allowed to
Um,
claim. Is it a religious issue?
Well, they'll say it's an ethical issue. The government,
But
the
ethics
government
comes
doesn't
under
see
what?
moral things.
Ethics was drawn out from what?
Morality, to be fair.
Morality was drawn out from what?
Ah, I don't know. Sisi, tell me which one.
Religion.
Oh, I see. That's where you're going.
That's the foundation.
That's where you're going.
Powerful way to make a law without making it, oh, you're not religious. Okay, it's fine. It's an ethic.
Mm, mm,
It's
mm,
not government things, ethics. And
mm.
that's where I'm getting at, because it's one rule for the NHS, one rule for the rest of us. We are just a statistic when it's convenient.
Yeah.
We had a very good friend that had to take the NHS to court and won because of all these kind of shoddy things. My physical being, my back is not the same after having my last baby because
Mm,
I was poked for 1 hour trying to get an epidural in.
mm.
And there are a lot of people that actually do not get up from that, and they are. I know of a lady that is disabled for life. She was having, I think, twins as well, and that's what happened to her. So when you look at all these things, like there's a lot of things that call to question. I admire the NHS. I think they have done magnificently well. And like I said, it is a job, it is a way of life, and they are learning as they come along. But there are some certain things that there should be no middle ground.
See, okay. Um, any system that is chaired by, how best to say, humans is obviously open to human error. No one is above mistakes. Even in quote unquote normal day jobs, people make mistakes and therefore are open to um, ridicule.
Mm,
The issue is the mistake made in the health industry as well as the airline industry, like I said earlier on, results in death.
yeah.
This is not, oh, it's a mistake. Someone has died. This poor boy, I praise in heaven, has gone before his time. His mother has to bury him. That's one of the worst things ever. Ever. And what we're talking about here is not to mock them, it's to challenge the thought process, to do better. My friend, the one that her son had the keyhole surgery, fought for months for her child to be seen. And please, for those who come in with racism, she is not black, she's white. So it had nothing to do with
Right.
that. It had nothing to do with her race. It had to do with the doctor listening to the voice of a mother.
Mm,
Most of the time, and let's be honest with ourselves because we've experienced it in different ways.
forms,
When
yeah.
we go and say we think this is wrong, they will treat us like we are mad. And
Mm,
the probability of you being mad compared to you being right is less, it's low. So maybe one out of 10,000 of the mothers who go to complain to the doctor is wrong about the condition of their child,
yeah.
but the other 9,999 are correct. Listen to us. If
Yeah.
something is wrong, we
Yeah.
don't know what it is because we're not medical professionals,
No.
but we're coming to you as a medical professional to say, please help us get to the bottom of this. Now, we know your job is not easy because we hear, like we shared earlier on, a lot of doctors going off to, they're going to Saudi Arabia still, a lot of Middle Eastern countries and Canada. Canada is like the pirate of the medical field right now, just getting doctors from any and everywhere they can. Brilliant. I hope they have really good healthcare in Canada. But right now, what we're going through with the NHS in the UK is causing death. It is causing
Controlled
death.
hardship and death.
Please, the voice is out there. Let us advocate for our children. Do not let anyone tell you you're mad. Even if you are mad, at least let them prove it before they sign you off with that child.
Yeah.
That is it. It's this is, if you will, a mother's heart's cry. Like I said, Cecilia and I are mothers. We are very, very sad about what's going on. A child has lost their life.
The family is grieving.
What kind?
Siblings have lost their sibling.
There's nothing you can say. There's really nothing that can be said beyond, Lord, comfort those who are grieving. Comfort those who are grieving. And doctors, if it was indeed a passion of yours, look for that spark again,
Yeah.
where you were concerned about making people better, not just in it for the money. And yes,
Or not just a tally number, a revolving door, in, out, onto the next, all of them are the same.
and we know the NHS is not that conducive, but the point is you're still dealing with humans on the other side. So the NHS being your boss, it's not an ideal situation, but you're still dealing with a human life on the other side. Please pay attention to us. Please. Sissy, do you want to say anything else before we close on this episode?
No, our heart goes out to that family. I pray God comforts them. I can't even think of anything because we're in two alternate universes in the sense that they are in Nigeria and we're in the UK. And you often wonder, the mom's gonna ask questions. Did I miss anything? Did I notice something that I wasn't sure of? There's so
Oh
many
my.
things. So many unspoken, like, I don't know, regrets maybe.
Hmm.
So
Hmm. Okay. On that note, we're going to end this episode. I know we're a bit sad about it, but I hope you hear a mother's cry. There is a mother
yeah.
crying right now. There's several crying right now. Let's do better.
Yeah.
Okay, it's been two Nigerian women. We would appreciate if you like, subscribe, and share. Comment. Let us know your thoughts on what we've discussed, and we will see you in the next episode.
Yeah. Bye.
Save
Have a
life.
wonderful week. Bye.
Bye bye. Bye.